I was asked to speak a little bit about the relationship between vegetarian diet and comorbidities in cancer. And as I think about this, comorbidities in cancer are really a function of morbidity in general. Many of the cancers that I see, or the most common cancer that I see as a gynecologic oncologist, is endometrial cancer, which is a malignancy that is this part of the spectrum of type 2 diabetes, then metabolic syndrome and obesity. About 80% of endometrial cancers are caused by this. And so when I think of comorbidities related to cancer, I'm thinking of morbidity in general. This I thought was a fascinating slide, and I want to point out this to you. Anybody have any ideas what's happening here in this spike right there? Anybody know? That's 1918. That's a big hint. Anybody know? The influenza epidemic. Dramatic morbidity and mortality. It occurred amongst young to middle-aged men and women, many in the prime of their life, and you can see what happens, an amazing hit. Just as you look at this, you can also see, it's hard to make this out, but right through here, there's a slight plateauing, slight rise, then a drop, and it drops all the way down. This is another infectious disease, pulmonary infectious disease. Exactly, tuberculosis. So you can see what killed men and women in the early 1900s has dramatically changed. What's this right here? Any hints? It's the biggest killer, heart disease. So what happened in 1964 that has dramatically changed what was it? The Surgeon General identified smoking as a cause of lung cancer and maybe cardiovascular disease. Well, shortly after we identified that, right there, look at what's happened. Pretty remarkable, isn't it? 50% decline, cardiovascular mortality. Now, I realize this isn't vegetarianism, but it is here to talk about what's the big picture. Okay, what's this right here? Going up slowly, slowly, slowly. We started a war on that back in the 1970s. It kind of peaked out and now it's starting to go down. Exactly. So this is the cancer mortality rate right now. You can find this. It's a New England Journal of Medicine article, 2012. It's a fascinating slide. You can click through and figure out what's in there. I thought it was fascinating. But in any case, sorry, going the wrong way. So cigarette smoking was an unrecognized, or at least unpromoted, cause of mortality. We've been able to get rid of half of this, although it remains 18% of our population, both here in Washington State and nationally, still smoke. I don't know about those you guys, but we're responsible in our practice to identify smoking status and intervene on every patient every time. And the number of women, of course I see all women as a gynecologic oncologist, who are former smokers is substantial. The number of current smokers is relatively low. I attribute this both to the superior self-control of my female patients, as well as pregnancy. You know, there comes a time when somebody else is depending upon you, and that's when many of our patients make the decision to quit gratefully. Another important feature is both diabetes and obesity. Now, you guys have spoken about this, so I won't take much time, but I find this series of slides fascinating. How many of you have seen this? Look at the scale at the bottom left. You can see it's getting higher and higher as the years go by. So this isn't red state, blue state, it's all blue state. All right? So in any case, you can see the consequences of diet. And this is where we start to talk about the vegetarian diet. This is really where public health hits the ground. Now, obesity and diabetes parallel one another, as do cancer. So here's a similar series of slides looking the same way. Take you a couple of seconds to realize this. How many of you have seen this series of slides before? Is this widely known? Okay, forgive me. I won't inflict it upon you next year then, I guess. But in any case, I think it's safe to say, in fact, it is safe to say, the scientific consensus, perhaps not widely promoted, but the scientific consensus is that the standard Western diet is not healthy. I don't think there's any real debate anymore. It promotes central obesity. It is a pro-inflammatory diet, increasing the risk of cardiovascular disease. It promotes insulin resistance, and that's exactly where my practice comes in, because insulin resistance and hyperinsulinemia is a cause for endometrial cancer and other cancers. We just talked about antibiotic resistance related to the farming practices and pathogenic bacterial outbreaks, etc. It's associated with dementia through the role of excess diabetes, and of course, it increases cancer incidence. And like I say, this is now mainstream. This particular slide comes from the Harvard School of Public Health. This reflects mainstream thinking about how we should eat. So there's really no more debate about what's the healthiest diet. You'll notice that the healthy protein, they haven't actually removed all flesh from it, but there's fish and poultry allowed, and then there's beans and nuts and so on and so forth. Avoid red meat, avoid bacon, cold cuts, and processed meats. So if we are willing to actually state the science, we're on solid ground. Forgive me. Why? Various molecular reasons here, as well as various observed epidemiologic reasons. And I'm going to try to keep moving. We've talked about the Adventist Health Study in several slides. It's a fascinating data set for the reasons that you already mentioned. And so I'll go through a couple of other details from this extensive data set present. You'll notice here that heart disease rates are decreased in vegetarians. Let me see if I can pull this up here. Although the confidence interval perhaps for ischemic still crosses 1, but in all-cause mortality, it is a protective finding in this group in this population. The Adventists are interesting, as you mentioned, because about 35% of Adventists do not eat meat at all, and about the remaining 65% do in various proportions. So it's an easy way to compare. Typical populations have 2 or 3 or 4% vegetarians, right, Stuart? Isn't that about correct? So that's why it's possible to study this group and get these answers. Mortality rates related to this type of vegetarian diet, as we've already mentioned, have gone or go down, with either the vegan or the pescatarian diets being the lowest, and the confidence intervals are very robust. Now, this is, I think, one of the more interesting data set points that I found. We struggled trying to promote the benefits of medicine to all of our populations. It is well known that certain minority groups, African Americans and immigrants of other types, suffer greater burden of disease than the dominant Caucasian population. Turns out that if you have, in the Adventist Health Study, which is an ethnically diverse group, very ethnically diverse, those individuals who have adopted the vegetarian diet are equal to other races with regards to health outcomes. The vegetarian diet is a tool to equalize health function across racial and ethnic lines, something that we in the healthcare professions have not been successful at doing. I think that's a pretty powerful statement to this. So how to help patients make the switch. And I'm going to offer you might even want to write down these little numbers, because that's the easiest way to get to these 2 papers. There are 2 quick, simple review articles published by the Permanente journal. And all of you know Kaiser Permanente. They have a financial benefit in promoting health and wellness at an appropriate cost, because every dollar they save, it goes directly to the bottom line. And in this in-house journal, it's now available to you. You search, you put PMC and those numbers into Google, and it will pop right up. And in Kaiser Permanente, there are 2 excellent articles. The first one from 2013 talks to physicians about why this is appropriate, and it goes through much of the data we have talked about. The second one talks about strategies to work with your patients. These are 5 or 6 or 7 pages. Sit down, and in half an hour you'll get a cram course in how to get this done. So I recommend it. I'm going to take the rest of my talk just briefly reviewing some of the data from here. This was in the introduction to the 2013 article, so I'm going to actually read it. I think it's very appropriate. Physicians looking for cost-effective interventions to improve health outcomes are becoming more involved in helping their patients adopt healthier lifestyles. Healthy eating may be best achieved with a plant-based diet. That's a direct statement. There's no equivocation, and I think it's for good reason. We define as a regimen that encourages whole plant-based foods and discourages meats, dairy products, and eggs, as well as all refined and processed foods. Obesity management. Now, there was a review by Burkow and Bernard where vegan and vegetarian diets are practically magic. How many patients would love to lose weight without exercising? How many of them would like to lose a pound a week by doing nothing more than living their life? How many of them would like to have the food they eat be more burned inside, increase their metabolic rate? This is the holy grail of dieting. And in fact, that's exactly what was observed. So you can imagine, vegetarian food, its caloric amount is measured in a bomb calorimeter. You put it into a vessel, apply oxygen, and burn it. Not every calorie in a plant is absorbed. There's fiber, there's lignans, there are other things. When you eat a plant, it's different than eating a piece of muscle or of an animal. All of that animal was an animal, so it will get digested and used. Plants are not that way. So it allows for and encourages weight loss per equivalent amounts of calories. Diabetes management. Vegetarians have about half the risk of developing diabetes, and non-vegetarians are 74% more likely over a 17-year window to develop diabetes, and the prevalence of diabetes increased 2.5-fold more frequently in those that were non-vegetarian, regular meat eating versus a vegan diet. Once again, Adventist Health Study, large numbers. This is in California, so this is America. This isn't in some population that is unfamiliar to us. And then again, another Adventist Health Study, randomized controlled trial, American Diabetes Association guidelines, the standard diet versus a low-fat vegan diet. You'll notice what was already mentioned. Increased drops in hemoglobin A1C and ability to drop and lose the need for supplemental medication. Heart disease, there's a lot of data on this. It's already been reviewed by cardiology. I won't go into more detail, simply to confirm that the intervention group in a Mediterranean diet study experienced a substantial 73% decrease in coronary events and a 70% decrease in all-cause mortality. Can you imagine a cardiac intervention that caused a 70% decrease in mortality? It is stunning. Cancer. The women in particular, and this is driven largely by endometrial cancers. Endometrial cancer is a metabolic disease. It comes from obesity, insulin resistance, hypertension, diabetes. Women who are vegetarian or vegan have much less of this, and as a consequence have 34% less cancers of the female reproductive tract. Half of all cancers of the female reproductive tract are endometrial. You take most of those away, there it is. GI tract cancers are improved as well. Colorectal cancer is higher in meat-eating individuals than those who eat a vegetarian diet. Now, I put this slide in because there's a lot of bad press for soy. And I want to try to reassure the group. I don't think that the bad press is really fair. Soy isoflavones and the fear about breast cancer and the use of soy. Soy is not, especially in a balanced vegetarian diet, unless you're taking supplemental massive quantities of this all the time, is not going to be a major promoter of any of breast cancer risk. So I asked finally, is a vegetarian diet a radical concept? Well, let's ask, is putting stents in? Is triple bypass? Is lifelong medication, antihypertensives, statins, antihyperglycemics, and insulin, which is cancer promoting? What's radical? Eating a vegetarian diet which is healthy and appropriate to fit our physiology is the right choice, not the radical choice. I encourage each of us to encourage our patients to do this.